Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How is Takhzyro injected/administered? Takhzyro, lanadelumabflyo, is available in a prefilled, one-dose, ready-to-use syringe that takes less than 1 minute to administer yourself. It is easy to learn how to self-administer it, but initially, it is helpful if your nurse or healthcare provider shows you how to use it. If you are not comfortable injecting it yourself, then a caregiver can be trained to give it to you. When it is time for a dose, take one Takhzyro syringe out of its box in the refrigerator and leave it to warm up to room temperature for 15 minutes. Do not try to warm it up in any way, such as by putting it in hot water or with the microwave, and do not shake it. Check the expiry date on the syringe and do not use it if it has expired or if the liquid in the vial appears discolored or contains visible particles. It should look clear to slightly opalescent, colorless, or slightly yellow. The syringe should not be broken, cracked, or damaged in any way, but small bubbles within the liquid are normal. Prepare for your injection by taking an alcohol swab, a cotton wool ball, and an adhesive bandage. Choose a site on your body where you will inject Takhzyro, such as your stomach area, but not within 2 inches of your belly button, or your upper thighs. If a caregiver is giving you your medicine, you may also choose your upper arms as a place to have it administered. Do not choose an area that is bruised, broken, or scarred. Each new injection should be given in a slightly different area to the one 2 weeks previously because this helps to reduce scar tissue formation. Wipe the area with an alcohol wipe and allow it to dry. Do not blow on it or touch it. Hold the middle of the Takhzyro syringe with one hand and pull the needle cap off with the other hand. Throw it away. Pinch up the area of the skin where you want to inject Takhzyro and keep holding it pinched as you insert the needle into the skin. This makes sure Takhzyro is injected subcutaneously into the fatty layer under the skin. Insert the needle into the skin with a dart-like motion at a 45 to 90 degree angle, then slowly push down on the plunger until it stops. Gently remove the needle and then let go of the skin. Wipe any blood that appears with a cotton wool ball and then place an adhesive bandage over the injection area. Throw the used Takhzyro syringe in an FDA-approved sharps container. Takhzyro is usually given in adults at a dose of 300 mg. This is the dose contained in one syringe, once every 2 weeks. This dosing interval may be extended in some people who are stable for 6 months to once every 4 weeks, but discuss this with your doctor first. It should be kept in the refrigerator between 36°F and 46°F, 2°C and 8°C, unless you are about to administer a dose, then it can be left out of the refrigerator for up to 2 hours. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.